Hi, a little bit more about the NHS and why it fails. I don't mean it always fails everywhere. Of course I don't mean that every experience everybody ever has of the NHS is bad. Whenever the NHS is criticised publicly, loads of people will come out and say, well yes, I had a really good experience with the NHS, or they'll say, well, the NHS saved my child's life, therefore the NHS is wonderful. Now, okay, when you scroll back though, you'll find, well, actually it was the doctors and the nurses who saved your child's life, and if you were in another country that had a developed, modern, realistic, appropriate healthcare system, such as Scandinavia, Japan, Egypt, then you wouldn't have had the NHS, but your child's life would still have been saved because it was the medical science delivered by doctors and nurses that delivered it. And although that care took place in the context of the National Health Service, it could equally well have taken place in a different healthcare concept. But it's difficult getting people past that point. I do want to talk briefly here about the different ways that you can fund healthcare systems. You can fund them by direct payments from the person using the healthcare to the doctor or the healthcare organisation. Direct payments, which is what people think is the only thing that happens in America. People here have a very, very jaundiced idea of American healthcare. Or you can have insurance systems, and there's more than one kind of insurance system. You can have an insurance system that is purely driven by the desire to maximise profits for the shareholders of the insurance company, or you can have a social insurance system, something like a friendly society, like what we used to have before the NHS nationalised all of those things in 1948, brought them in under state control. The story that's not often realised, that we did actually have healthcare in Britain before 1948. A lot of people don't think that we did. But anyway, some kind of insurance, personal payments, patient to doctor payment, insurance, or taxes, taxpayer money. Now, most systems in the world, including the American system, but most systems work on a mixture, a balanced mixture of all three. And I think that's a sensible way to go. If you had a system where it was nothing but the person who was ill paying, then that could be very difficult, because anybody, I mean, before I finish making this video, God forbid I could collapse with a stroke or heart attack, might need £100,000 worth of treatment. That's a good argument for insurance system, it's a good argument for a safety net. But it's not a good argument for the wholesale nationalisation of healthcare, which, you see, if you say, well, healthcare should be free when you see the doctor and you should not have to pay anything, it should all be paid for by the government, what you're saying is this, that those people who tell lies to get into power, those people who stab each other in the back, those people who can't count, those people like Gordon Brown, who sold off half of Britain's gold reserves when the price of gold was at the bottom of the market, and by announcing the sale in advance he drove the market even lower. That one stupid action wasted about £15 billion of taxpayers' money. I mean, people as dumb as this, I mean, people who start wars that they had no right to start, and afterwards say, okay, so we got some bad information, it happens, we move on. Yeah. But I mean, just look at them. If you ask people in this country who are the lowest pieces of filth that crawl in this country, a lot of them will say politicians. Okay, so these are obviously the ideal people to put in charge of our healthcare system. Okay. Now, healthcare can be paid for three ways. One of three ways: direct payments, insurance, or taxes. Most sensible countries do it by a mix of all three. The taxpayer money going in as a base to provide a safety net and to provide maybe some infrastructure and some training and necessary regulation. Insurance, yeah, any sensible person would want to be insured. I mean, this house that I live in is insured. Paying directly. Now, this is where it gets controversial. If you have to pay directly for everything, then you could end up with a bill that would bankrupt you, and you'd live in fear of that. I don't want that to happen. On the other hand, if you pay nothing, then people will abuse the system, and this is what we find. I read a story in the British Medical Journal the week before last. This was in a blog in the journal, or a diary. This was a middle-aged woman who had consulted the doctor 167 times in the last 5 years. Now, she wasn't seriously ill. She was, you know, a bit of headache, a bit of discomfort, a bit of concern, a bit of, oh, this doesn't quite feel right, doctor. But look, we're talking about somebody going to see the doctor about every 3 or 4 weeks. The doctor writing this blog said, well, if everybody had the same kind of healthcare seeking behaviour that this woman demonstrated, we would need to have 4 times as many doctors and 10 times as many nurses. I mean, do you get it? One of the biggest problem when you talk to people in Britain, what are your biggest unhappiness about your doctor? Well, I can't get in to see him because he's too busy. If we had to pay a modest, affordable fee when we went to see the doctor, not the full cost of everything, but a modest, affordable fee, it would limit our healthcare seeking behaviour so that people wouldn't go to see the doctor. When they've got a headache and they need some paracetamol, instead of going into the chemist and paying £2 for some paracetamol, they'll go and see the doctor to get a prescription because it's free. You get me here? And of course some folks say, oh, that's terrible because that would discourage people from seeking the doctor and they wouldn't go until they were really, really ill and it would cost more in the long run. Well, funny you should say that because Britain is actually, as far as I know, it's the only country, only developed country, only country I think at all, anywhere in the world, where you can go and see the doctor as often as you like and you don't have to pay a penny when you see the doctor. Now in France, where you have to pay about €20 to see the doctor, and they're a very socialist country, in some ways more than we are, you have to go and pay £10 to see the, £10 or £15 to see the doctor. Would it mean that people would say not present with their illnesses early on so that they would die? Well, they have better cancer survival rates in France than we do here, so I mean, that's just an idea to defend the status quo. But when people have been used to getting something for nothing and they've become to believe it's their fundamental right, then telling them, well, now you've got to pay for it, well, that would be a very difficult problem. We still effectively have a bipartisan political system. We've got the Conservatives, so-called Conservatives on one side, we've got Labour, Socialists on the other, and they're always at each other's throats. Now, if one of these people said, right, we're going to introduce some charges to see the doctor in order to reduce inappropriate levels of demand, which are choking the life out of the service, and there's no doubt at the moment there's a big debate in Britain about how accident and emergency, our out-of-hours services are on the point of collapse. I'll talk a bit more about that in another video. But the one thing that would make a big difference very quickly would be by charging people, say £10 to go to see the doctor and £20 to go to A&E. People are going to accident and emergency with earaches and they can't be turned away, they've all got to be seen, and it's free. And that's the one solution that would help, and we're not having a conversation about it because of this fundamentalist belief that people have in my country that healthcare must be paid for fully through taxes, and it must be free at the point of use. No other country does this. It doesn't work very well, and we're having a terrible trouble trying to make the system work when it really isn't a very good model. Anyway, I'll say a bit more about this later.